I think we're almost ready to get into our proceedings today, a little bit in advance, but then punctuality is next to something or other. So this is the first, I was going to say the first real session, but that would be slightly disingenuous. Anyway, it's the first session really of our conference, the Covistress project, Global Perspectives and Implications. Now, before we actually hand over to, before I hand over to Professor Baker, I'd just like to say one or two words, because obviously this has been a difficult conference. It's been a lot of effort getting this conference together. It's been a collaboration both within HKBU between various people, particularly actually I think between Professor Baker and myself and Professor Cabistan and Dr. Tran, Emily. So essentially it's been an internal effort, and then of course we've been fortunate really to have quite a few supports, if you like, from the outside. So in addition to GIS, the Government and International Studies Department, and the Sports, Physical Education and Health Department, we've also, another co-organizer of course is LEWI, the David C. Lamb Institute for East-West Studies. We've been supported by, this is part of the faculty's 50th anniversary, so thanks to the faculty for that, and PK I think is here, where he was a while ago. We've been supported internally also by the Institute of Creativity, for which many thanks. It's been really useful. We've also had support from the University Research Committee, again, which has been indispensable. And I must say that we've also had support from the ProCorps. Now the ProCorps, it's the UGC and the Consulat Général de France, Hong Kong et Macau, so the French consulate. Now that's absolutely super, because it means that we have a whole load of French scholars who are going to come over when it's possible for them to travel. Now, some of the French scholars will be online today, and they're going to be intervening. And indeed, we have scholars from the UK as well. And we have a whole bunch of scholars from Australia tomorrow. So in a sense, this is an international conference. And I think what Professor Guo was saying is pertinent. This is genuinely an international conference. We'd like to thank all of these sponsors, and I will not forget the European Union office, who is offering a reception tomorrow evening, and the Heinrich Bull Stiftung, which is the one of the important foundations here in Hong Kong. So I won't say much more about all those generous benefactors, except thank you. Okay, and now we're going to move on, I think, to the time is almost up to start the presentations. The first session, the Covistress project, Global Perspectives and Implications. It's very interesting, actually. We pushed forward a lot of our thinking on this conference at the Pacific Coffee. Now, the coffee's rubbish. And no, I'm not saying that's not true. It's coffee. It's okay. It's okay. As I wouldn't say, you know, that was, I didn't really say that. The coffee's as it is, but the conversation's stimulating. Okay, particularly when now you go to the Pacific Coffee, it's wonderful with the outside chairs and everything. But when we were hatching this conference plan, it was dark, it was somber. Anyway, so but the thing is, a lot of the conversations took place around coffee in the Pacific Coffee, and I would say thanks to Benny as well there, who's not just, of course, technically been very important in getting this together, but also intellectually and practically, actually. And it's been a genuine collaboration, I think, between our departments, so that's great. Now I'm going to now move. We're going to now move into the heart of this, but it all started off really with a discussion about trust, actually. Julien said, well, what are you working on? So I said, well, I'm working on trust. So then, okay, that's interesting. And so we then started talking about political sciences, medical sciences, the role of trust, different levels, and we found we had something to talk about genuinely there. And so I think that, you know, that gave us the idea of this conference. So without further ado, I think it probably is time now, I think, to move to the, we have 4 papers. We have 4 papers today. Let me just get my notes. I don't usually need my notes actually, but I do occasionally because there's a mistake in the program, and I apologize profusely to Gemma because the title in the program was a typo, so apologies for that. But we have 4 paper givers. Julien Baker, our Professor Baker, is going to be speaking on immune function and COVID-19, physiological, psychological, and psychophysiological implications. And that would be the first paper. Then we move on. Dr. Linda Zhong from our School of Chinese Medicine will be speaking on Chinese medicine wisdom on COVID-19 from prevention to rehabilitation. And then our third paper will be by Gemma, and it will be a clinical study protocol for COVID-19 rehabilitation with tele-exercise and herbal medicine. And then finally on Zoom, we'll have our Professor Fred Dutey, who's getting up very, very early to be live with us before going about the day job, so to speak, which is amazing. And he'll be presenting another angle on the Covistress project, global perspectives and implications. So with no further ado, then I'll hand over to Julien Baker for the first of our presentations.
Okay, thank you very much. Can you hear me okay? Okay, good. So I'm going to do a little overview on immune function and COVID-19, psychological, physiological and psychophysiological implications. It's a general overview. Some of the data is based on some of the studies that we've collected already, and we've done quite a large amount of work in this area with a big project starting in June that Gemma is going to talk about a little bit later on. So the Centre for Health and Exercise Science Research, just to give a little bit of a background on this really, this is the centre we set up about a year ago in sport, physical education and health. The centre is responsible for the clinical, biochemical and sort of, novel, if you like, experimentation that we do, particularly related to diabetes, cardiovascular disease, immune function, biochemistry, hormonal control of exercise. And the main project that we're chatting about later on, and the one I'm going to overview today, some of the findings, has come from this centre really. It was a centre that we established to put the sport, physical education, and health department at a different level in terms of the types of research, very much health orientated, very much clinically orientated, and has provided already a huge amount of publications, over 100 in the last year, and several large grant applications, some successes, some pending, So it's been a very, very good idea, a very good concept, and most of the staff are involved with this, and we've got 3 postdocs on board and several PhD students as well. So it's a very productive unit, and most of the studies emanate from this. So I just wanted to give you the little overview where the science has come from, really. Honestly. So psychological benefits and exercise of COVID-19, and the physiology of exercise is very, very important in this. And exercise is a medicine without taking medication, if you like. And exercise will give you tremendous health benefits, but you haven't got to take medical supplementations. So what are the benefits of exercise? Obviously, reduced risk of cardiovascular disease, strengthens bones and muscles, 50% lower risk of type 2 diabetes, helps to control weight, improves sleep, improves energy levels, 30% lower risk of dementia, which is very important, and prevents cognitive decline. Now, why have I shown you this? Because part of the problem with the pandemic is that people were physically unfit. The pandemic got hold of the populations because to a certain extent, their immune functions were compromised. And if you look at the figures and the statistics, you'll see that large cohorts of obese populations, unhealthy populations, people who were not physically active, were very vulnerable to getting the disease. So that's the importance of exercise in this. And exercise will boost immune function responses and help fight illnesses. So it's very, very important, really. The immune function and exercise, moderate intensity exercise appears to be the best way to increase immune function. By moderate, I mean not too hard, not too difficult. So a small amount of regular exercise will boost your immunity. Immunity function is greater in the elderly that are conditioned versus sedentary individuals. Exercise reduces the risk and severity of respiratory viral infections, which the COVID kind of is. And being moderately active reduces the likelihood of upper respiratory tract infections as well. So flu, influenza, the start of things like that. Acute moderate exercise stresses the immune system less than prolonged high intensity exercise. So high intensity exercise, i.e. working very, very hard for prolonged periods of time, may not be the answer. And hence the problem with athletic populations, particularly elite athletes, who get a lot of infections. Because of the COVID pandemic, exercise has had to be done at the home. People can't socialize and mix. So these are kind of the sort of exercises we can do in the house or at home on our own without social interaction. And obviously we can do some of this via telemedicine as well, which is part of the project that one of my colleagues will speak about later on. So it's quite easy to stay active in the home, quite easy to stay active in the home. And these are just some examples of the things we can do. Now, obviously we can work to a specified heart rate if we want. The importance of the programs are that they should be individualized to individuals' capabilities. So some people may be able to cope with higher intensities of exercise than other individuals due to genetics, fitness, gender, things like that. So the exercise programs should be specific to the individuals that are participating in them. That's very, very important, okay? So increased inactivity and sedentary behavior, worsened disease activity and symptoms, poor cardiovascular risk profiles, decreased physical capacity, decreased functionality, increased symptoms of mental stress, poor overall quality of life. And as you can see already, some of the psychological factors are starting to creep in there now. So maintaining active or increasing physical activity levels, controlled disease activity and symptoms, controlled cardiovascular risk profiles, maintain physical capacity, maintain functionality, attenuated symptoms of mental distress, and improved overall quality of life. So already with the physical attributes, the benefits of exercise, we're starting to see crossovers between psychology and physiology. So the physical activity profiles, or enhancing the physical activity profile, is going to give us a better psychological perspective as well. So this is what actually happens when we exercise. We get an increase in the B cells, which modulate immune function, an increase in the T cells, which combat infection and disease, and obviously an increase in the natural killer cells, which also combat disease. There's an increase in catecholamines, that is the hormonal control of exercise, particularly adrenaline and noradrenaline, and the myokines are also stimulated, which regulate B cell production. So biochemically, exercise is very, very good for us in terms of our circulating immune function. And that's what helps us fight the diseases. There is a relationship, as I've just said to you, or tried to explain to you briefly, that if we work too hard, we'll get a negative immune response, i.e. the immune response will be depressed and it won't be as effective as working at moderate intensity exercise. So we can see here, look, if you work above average, the risk of infection increases dramatically. And if we work moderately, the risk of infection decreases. So that's very, very important. That's a very good schema to explain and to understand about the potential benefits of exercise, albeit working at the right intensity of exercise to maximize the potential of the system to respond immunologically. And what counts as moderate intensity exercise or physical activity is very, very good. Very simple things like walking, gardening, hiking, dancing, cycling, active recreation, and swimming. Of course, as I mentioned earlier, some of these social interaction ones during the pandemic could not be followed. So it would have been better, or is better, to exercise at home on your own, or exercise in the evening when there's nobody around, so you're in isolation. But certainly they're the ones that improve the immune function. And amazingly, something as you know, non-eventful as gardening can give you a boost for your immune response. So here's the sort of optimal effects, if you like, the health benefits. As we can see, we've got the light exercise there in green, moderate in yellow, heavy in red. And on the bottom line on the axis there, exercise quantity and intensity, i.e. overload, vertical axis, health benefits. So as we can see there, there's an optimal effect. There's an optimal effect for health benefits in relation to exercise and immune function during the moderate intensity exercise. We've got a decrease in effectiveness in heavy exercise, and light exercise starts to increase and peaks at a moderate intensity. But it certainly declines when the exercise becomes too heavy. So we compromise ourselves immunologically because we're exercising too hard. We're exercising too hard. So that's a kind of little overview of the physiological benefits, I suppose. The take-home message, very important, moderate physical activity has a beneficial effect pre and post-COVID-19 and increases immune function. And as I've said earlier on, if some of the individuals that were susceptible to COVID-19 in the pre-stage had exercised and were quite fit, they may have had less of a detrimental effect from the disease itself. COVID-19 infection is related to poor physical activity levels, pre and post-pandemic. And interestingly enough, the protocol that my colleague is going to speak about later, we're going to investigate this post-pandemic, and we've got some findings that she's going to present later on. Physiological and medical comorbidities, i.e. diabetes, obesity, cardiovascular disease, may have improved as a result of physiological intervention. So the effects of those comorbidities and relationships with COVID-19 may have been lessened if those individuals had exercised prior to the onset of the pandemic. So the exercise intervention is extremely important, and it's a habit that we should all be looking to get into regularly, at least 3 times a week. So psychological effects, and we've touched on these a little bit already. So being physically active protects against mental health problems, decreases depression in older adults, reduces the symptoms of postnatal depression, is as effective as medication for mild to moderate anxiety and depression, improves self-esteem and cognitive function in young people, and playing sport reduces psychological distress by 34%, 1 to 3 times a week, and 47%, 4+ times a week. And individuals who participate in sports clubs and organized recreational activity enjoy better mental health. Now, this is very important post-pandemic, when we can start to become active again in clubs and in groups. It's extremely important that we encourage individuals, particularly the young people, to get active. And the World Health Organization states that a huge proportion of the population worldwide is not completing enough physical activity per day. So we need to change those statistics, really. So this is the health footprint of the pandemic, I suppose. So in the first wave, immediate mortality and morbidity of COVID-19 was very, very exaggerated. Huge amount of deaths, huge amount of illnesses, lack of preparation by governments, etc., etc. Then we came the second wave, the impact of resources, restrictions on urgent non-COVID conditions. So the first wave was compounded by the second wave in terms of administration, management of COVID, the government, the medical treatment, the knowledge base, etc., as other things like that. The first wave then started to curtail, came down. Then we had the third wave of the pandemic, which interrupted care on chronic conditions. So because of the problems associated with the first and second wave, the chronic conditions, the people in ICU were very, very vulnerable. The fourth wave became a real problem in terms of psychic trauma, mental illness, economic injury, and burnout. So the population suffered massively psychologically from the fourth wave. When they thought the pandemic was over or becoming manageable, shall we say, the psychological impact of it not becoming manageable really hit the population hard. And then there was a huge increase in psychiatric problems, a massive increase in depression, anxiety, fear of going out, fear of wellness, frailty, those kinds of things. Interestingly, ages 18 to 24 years were the most affected in terms of depressive disorders and anxiety. 25 to 49 is still almost 50%, 50 to 64, 31%, 65 plus, 29%. But interestingly, It's the young people who suffered the most from the pandemic. The social interactions was cut off. The leisure time was cut off. The social development was cut off as a result. So they were the group that suffered the most. And that's a very, very interesting finding, because you would have thought that it would have been the older kind of individuals, I would have thought or hypothesized in the beginning, that would have been affected the most. But it's the young people who suffered the most from the pandemic. So distress related to COVID-19, mild and intermittent. The subjects need reassurance. They need strengthening social support, relaxation and lifestyle modification measures, moderate to severe and persistent distress, consultations, mental health professionals, psychological interventions, pharmacological interventions. Also, you could use both pharmacological and psychological interventions. However, I'm not sure if that's the right way to go because of the long-term prognosis for those kinds of treatments. Also in there is relaxation exercises, supportive counseling and problem-solving strategies, and diagnosis-specific treatment recommendations. So several ways of treating distress related to COVID-19. I personally think that we need to be very careful with this, because we could be developing, a pharmaceutical culture where everybody takes a tablet for illness instead of trying to manage it in a particular way, even if it's a mild kind of illness. Certainly some depressions are very severe and may need medical interventions, but the milder ones may be treated non-pharmacologically, and I think that may be a better way to go. Coping during the COVID-19 pandemic, a lot of people, were interested in music, for example, online learning courses, indoor play, relaxation exercises, yoga and meditation, aerobic exercise, prayer. A lot of people looked to religion, creative activities, positive thinking, and installation of hope. And installation of hope, I think, is a very, very important one, because depression is partly related to that. And of course, a lot of that was done via mass media on the internet and communication mechanisms outside of actually meeting people. So all people cope differently with the pandemic. We don't really know which was the most effective, and they are specific, because some people respond differently to different strategies when you're coping with a pandemic. Yoga, for example, may not suit everyone. It may suit a large percentage of the population. And music may not suit everyone. So it's all individual specific. Individuals have their own ways of coping with things. Tips for positive mental health during the pandemic. The do's: positive thinking, regular exercise, balanced diet is very, very important. Relaxation exercises, get into a regular daily routine, very, very important. Socialization, as I've just previously mentioned, the only way we can do that during the pandemic is online. Taking a break from routine work life, other healthy lifestyle measures. The don'ts, obviously substance use or misuse, eating too much fast food, excessive online activity, excessive watching television, mostly the news, partying. It's difficult to party on your own, but there we are, some people do that. Travel, focusing on the negative aspects of the COVID-19 pandemic. Now that's a very important one, because we've got to try and get away from it, really. And the news recently, for example, is saying about lifting the lockdowns and things like that. Then the next day it says, we're imposing the lockdowns. So the news can be very depressive in itself. And it depresses me sometimes, I must say. But we've got to try and get away from the news and think positive about things. Posting about COVID-19 on social media and spreading fake news, and more importantly, believing fake news. But the only problem with that is we know it's fake, and sometimes it's very difficult to distinguish between fake news and good news. So they are the do's and don'ts. I think they're quite sensible, quite doable for most people. And as I've mentioned, I think that we've got to maintain a positive attitude. That's extremely important in all of this. The take-home message: moderate physical activity is a beneficial effect pre and post COVID-19 on psychological measures associated with the disease. COVID-19 infection related to serious psychological disorders in all genders and populations. However, it appears that the younger generation seems to suffer more than others. Psychological complications manifest themselves in different ways, and recognition of the associated problems is paramount for recovery. Now, that's a very important line, that last one, because is it the psychological or the physiological outliers that are causing the problem? Is a psychological problem manifesting itself psychologically because of a physiological condition, and vice versa? Is the physiological condition manifesting itself because of a psychological underpinning? So we need to look very carefully at the individuals and identify where the problems lie, what the problems are, and the best way to treat them. And as I've mentioned briefly, I don't think pharmacology may necessarily be the best way. In severe conditions, yes, but counseling, talking to people, obviously exercise, increases again post-pandemic in socialization, mixing, talking to people about general health and wellness is all very, very important. So psychophysiological implications of COVID-19, and I suppose psychophysiology is the physiological correlates of psychological processes and behavior and the impact of psychological or behavior manipulations on physiology. So they're inextricably linked, I suppose. So the two areas we've just spoken about, psychology and physiology, become inextricably linked and manifest themselves in different ways to become psychophysiology. So a lot of it will be related to hormonal control, biochemistry, and the way we think and how our psychology interacts physiologically with the individual. So these are the psychological effects, I suppose, psychophysiological effects. Muscle adaptations, soreness and markers of muscle damage, range of motion, stiffness, cardiovascular and respiratory variables, mood states and sleep, muscle glycogen levels, sports performance, injuries, hormonal control, neuromuscular function and contractile properties, immune system responses, lactate in the blood and muscles, and muscle adaptation. Interventions may be low intensity exercise, low intensity resistance exercise, low intensity land-based exercise. So they are the things, again, in terms of exercise that we can use to manipulate the psychophysiological effects of the COVID pandemic. And as I've said, the hormonal effects of exercise may be linked inextricably to the physiological effects. So you may increase your hormonal concentrations by becoming stressed. For example, anxiety increases the cortisol concentrations. Cortisol concentrations also increase as a result of exercise. So that's an interesting one, because in a patient population who are depressed, are the cortisol levels elevated because of the depression or because of the exercise? If you exercise somebody, can you decrease cortisol concentrations caused by stress? And cortisol is a very important one, because cortisol stimulates free fatty acid metabolism. And if free fatty acids are not metabolized, they get laid down in the plaque, as plaque in the arteries and the veins, and that's what causes cardiovascular disease. So very, very important, very important. So music and exercise, and we're looking at a project on this now, that's why I included this slide. Music and exercise certainly affects the psychological behavior of people. It affects mood and subjective fatigue. The psychophysiological consequences: arousal, dissociation, autonomic control. Physiological: increases oxygen uptake, increases cardiac output and blood flow. Again, the hormones are in there, increases the hormonal response and increases lactate clearance. So music, depending on the type of music, whether it's soothing or robust or loud or quiet or relaxing, will have different effects on individuals. And different individuals may affect differently to different types of music, depending on the phonics and the frequencies and things like that. But music has proven to be very, very beneficial to individuals with COVID-19 or recovering from COVID-19. Depression patterns, of course, we know about stress, which is linked to medical issues, financial problems, family problems, work stress. And don't forget, The top box there relates to most of the things that we find disturbing with the COVID-19 pandemic, particularly the financial and the family problems, which lead on to other things that are medical. So that's a very, very important first box, I suppose. So thoughts and feelings, hopelessness. There's definitely a feeling of hopelessness. And some of the findings from our previous studies have demonstrated that quite powerfully. Loneliness, sadness, and negativity. 4 very, very disturbing words, really, that's in the psyche of the individuals post-COVID. Physical issues, sleep, changes in appetite, general aches and pains, low energy. The low energy, the deficit in energy may come from the psychological parameters, non-motivated, don't want to do it, can't be bothered, those kinds of things. Behavioral patterns, social withdrawal, inactivity, and a feeling of numbness socially. So in terms of social interactions, a lack of ability to communicate, resulting in a numbing sensation of the psyche. So the depression patterns there are very, very powerfully demonstrated. So here's another little schema here, which is an interesting one. I've got spiritual on this one. So a sense of purpose, deep values, needs to matter. And the spiritual, the prayer aspect of recovery from COVID seems to be very, very powerful, independent of religion, independent of ethnicity. Very, very powerful. It's helped people immensely in the recovery from COVID. The physical, we've mentioned briefly, food, exercise, sleep, and rest. Mental issues, doing one thing at a time, no distractions, clarity of what we're trying to achieve, what we're trying to do, and the setting of realistic and obtainable goals, and concentrating on one thing that's the most important that you want to achieve in a day, a week, or a month. Emotional, how we feel, positive emotions are very important. Engagement levels, again, socialization effects, and engagement with the family, which obviously hasn't been possible in some instances with the COVID, and being valued as an individual. And a lot of the stuff that we've got back does suggest that people feel they're devalued in society because of the COVID. They've been marginalized into particular categories, and some individuals even frown on people who've had COVID. So there's a few issues there as well. So that's a very important one. This one, I think, sort of sums it all up quite well, really. So our behavior patterns, how we feel, our thoughts, that relates to our core beliefs, how we feel about ourselves, how we feel about others, and what the future is for everyone, for society generally. So our behavior, thoughts, and feelings link, particularly post-COVID-19, to the future, most definitely, what our perception is of other people, and what our perception is of ourselves in relation to other people. So it's very, very important. The COVID-19 outbreak itself has resulted in a sedentary lifestyle because of long-term lockdowns, low physical activity, and an increment in chronic diseases. There's been a problem with global nutrition, unemployment, global change in economic capacity, global increases in stress, depression, loneliness, and anxiety. So it's a worldwide problem. And the second wave of the pandemic has resulted in a global burden of obesity and metabolic diseases. And of course, some of the cases that have been put down as COVID-19 deaths, a lot have been caused by underlying comorbidities like obesity, like cardiovascular disease and diabetes. And there's also an increase in the rate of COVID-19 infected individuals and mortality. So we're not out of the woods yet. We need to be very, very careful. And the mutated strains and the different variants, of course, are causing major problems. And if everybody doesn't get vaccinated, the mutations will continue and develop in a lot more aggressive way. So we need to be very, very careful how we carry on. We've still got a long way to go yet before things are finally sorted out. So how has COVID-19 impacted on our health behaviors? There's a 3 times increase in anxiety, 80% less metabolic minutes of physical activity a week, 27% increase in weight gain, plus 21 minutes of screen time per day on the weekends, 40% of the individuals bought equipment to keep active. Whether they use the equipment or not is another thing. There's 18% more consumption of alcoholic drinks, which is understandable because stress. 39% to 65% the amount of people who cook more than 6 nights a week. 50% less people who eat fast food 2 or more times a week. And you can understand the fast food thing because of the isolation and the lockdowns, et cetera, and access to the restaurants. So they are some of the health behavior impacts. The conclusions: moderate physical activity has a beneficial effect pre and post COVID-19. COVID-19 infection related to serious psychological disorders in all genders and populations. But as we've said, it seems to affect the younger people a little bit more. Psychophysiological complications, the interrelationships between mind and body, manifest themselves in different ways, and recognition of the associated problems is paramount for recovery. And as I've said, we need to consider what is causing the problem. Is it a physiological one or a psychological one, or a combination of the both, or a large percentage of one and a lesser of a percentage of the other one, et cetera, et cetera. These are some of the papers that we published over the last year on COVID-19, 16 altogether. There's quite a few under review at the minute. And as I've said, the Center for Health and Exercise Science Research has published over 100 papers, not specifically on COVID-19, but other topic areas. Okay, thank you very much. Any questions?
Thanks, Julien. We can maybe take one pressing question. The idea is that at the end we'll have time for some questions, but we could perhaps take one pressing question if there is one. Bernie, yeah.
No, you gave a list of changes, people's habits and so on. By far the biggest one I've seen is I do a lot of hiking. I've got mountains all the time. And the change in Hong Kong is absolutely spectacular. I don't go walking on weekends anymore because it's too crowded. But I think that may be a long-term change, and it will also impact on the way things are organized. There are arguments in Hong Kong about country parks. So these changes will have knock-on effects, I think.
Yeah, I agree totally, and particularly with the hiking, that's a beneficial effect, of course. Yeah. That's a very beneficial effect. So that's great news. So from the negative, there's a positive, if you like. So that's exactly the sort of message we want to get across, is that people need to become more active, and hiking is a great thing to do, particularly you've got the fresh air, you've got the socialization, and the great views and environment. So you're increasing your physical capacity, but also relaxing your mind because of the lovely environment that you're hiking in, you know. So that's where that'll go. If you keep hiking, that'll go. So yeah, I agree totally with that. That's a great plus point.
We'll take one more. Well, I've got a question on the chat, so I'll give you the question on the chat, and then we'll go over to Linda's talk. Julien, this is from Anne. This is from Anne Reuker. Yeah, Anne Reuker. So thanks, Anne. Julien, have you considered the therapeutic value of nature-based activities? This is a current research focus of ours. Also, much safer to exercise, socialize in outdoor nature spaces.
Yeah, agree totally. Similarly to the hiking question, the nature-based exercise is a fantastic way to go, and I think it'll give massive benefits, both physical and psychological benefits.
Thanks very much. We're gonna move on because we've got a very dense. But thanks very much to Professor Baker for that very illuminating talk.
Good morning, and can you hear me clear? Okay, thank you for the invitation. And today's my topic is a little bit different from the others. It's a Chinese medicine wisdom on COVID-19, from prevention to rehabilitation. I'm Linda from the School of Chinese Medicine, Hong Kong Baptist University. So my speech will include 5 parts. One is the background part and prevention program in our university, and also the scientific findings, both from mainland China and also Hong Kong all over the world. also our rehabilitation program under the hospital authority, and the anticipated impact. So this is the current situation according to WHO's dashboard. So you can see the situation is still quite worse, and also a lot of people has been dead because of the COVID pandemic. And the Hong Kong situation is better now because according to hospital authorities data, there's only 1 new cases in the last weekend, and currently only 53 patients in the hospital. But according to this pen, you can see that the age group of 40 to 59 is the largest part in the discharged patients. So I think we already know that COVID-19 and the difficulties in the treatment, because you know, the COVID-19 virus has spread very fastly, and also if we do not vaccinate, it will infect 25 to 70% of the population. And also it will affect a lot of systems and organs, not only the lungs, but also liver, kidneys, and our intestinals, especially the digestive disorders, as well as the brain neurological disorders, also the eyes, nose. So all these things has made it difficult to find a unique treatment. The clinical trials on different drugs already reported, but quite disappointed at that time. Also, not only the antiviral drugs, but also the immune moderating drugs. So I think this is a new virus with more changes of human to human transmission than the SARS, and the disease can attract almost anything in the body with devastating consequences. So currently, the only present control strategy of the disease include the reduction of the secondary infections by early diagnosis and isolation of cases, also providing optical care to infected patients. The only therapeutic way currently is to symptom-based control, but not targeting on the virus. The existing treatment for the virus of COVID-19 is non-effective. In mainland China, but also in Hong Kong, Taiwan, and Korea, the Chinese medicine are being explored for providing prevention, treatment, and rehabilitative care to the patients. So I will talk more about that. Because as we all know that our immune system is a very complex and powerful defense mechanism. And also, if you want to keep your immune system work good, you need to have your natural protection against the invaders. That is the different levels. The level 1 is barriers, level 2 is innate, and the level 3 is adaptive. So Chinese medicine can work on different levels of our immune systems. According to some evidences and also literature reviews, that Chinese medicine's view on COVID-19 mainly include that actually in Chinese medicine, the COVID-19 belongs to a plague with the etiology of epidemic factor exposures. According to the diagnostic criteria of Chinese medicine, that the main part of the symptoms of COVID-19, such as the sore throat, the coughing, the fever, is all belong to the deafness and toxicity in Chinese medicine. And after the disease progress, it will have different types of patterns. According to the symptoms is that we can divide them into the Qi and Yin deficiency. It's mainly to the elderly people. And also the deafness, cold, and the blood stasis. Blood stasis maybe sometimes is related to the neurological symptoms. And the deafness heat is more severe, and they will have high fever, even difficulties in breathing. And the other symptoms, such as the poor appetite, nausea, vomiting, diarrhea, are categorized as the deafness. So all these that is based on Chinese medicine theory, and also they have related herbs or formulas to treat the symptoms. Actually, we have different stages treatment according to the Chinese medicine's view, especially during the medical observational period that they are not diagnosed and the virus is not positive, the testing is not positive. They have different clinical manifestations, such as the fatigue with gastrointestinal discomfort. And according to the guidelines of the Chinese medicine government of Hong Kong Hospital, as well as the national Chinese medicine authorities in mainland China, the recommended Chinese patent medicine is Huo Xiang Zhen Qi capsule. It has capsule as a patent drugs. You do not need to cook the herbs. You just need to like drink the liquid or the pills. And during the clinical treatment period, they have different stages as mild stage, moderate, severe, and critical cases. The most treatment will focus on the mild and the moderate, and some herbs, some very severe symptoms like severe and critical cases will be combination with Western medicine. So the Chinese herbal medicine and acupuncture treatment will based on different and their individual symptoms. I will talk later about different formulas. And in Hong Kong, we have launched rehabilitation programs with hospital authority, collaborated with hospital authority. That the Mingling classification of the rehabilitated patients can be defined as the two categories. One is the lung spleen qi deficiency pattern, and the other is the deficiency of both qi and yin pattern. It's a terms of Chinese medicine, and they have different clinical manifestation. So we will use the Chinese herbal medicine as well as the acupuncture treatment based on different symptoms. As we all know that our School of Chinese Medicine, the Hong Kong Baptist University, is always a leading unit in Hong Kong to provide a Chinese medicine research and services. So we have a Chinese medicine immunity enhancement remedy has been distributed to elderly people aged 65 or above, and the patients with chronic illnesses, residents of elderly care homes, and other people to strengthen their immunities. And it has been donated. It has received donation from the people, and around 40,000 beneficiaries are getting the remedies, and we have already have some observational data about the elderly people. And we also have a cohort study on the preventive effects of Chinese medicine and to provide the scientific evidence in the future. And currently, under the support of Jockey Club, we have a formula that will not only prevent COVID-19, but also prevent the common cold. So this is the prevention formula according to the guidelines and also the consensus from Chinese medicine experts. So they have, you can see from that, they have different bunches of herbs, which will focus on the different patterns. Like 警戒薄荷连翘桑白皮 is focused on dispel the wine and heat and relieve the cough. 板蓝根金银花 is focused on clean the heat and resolve toxin. 佩兰茯苓 is work on eliminate the dampness with aromatics, and also 党参、象参、甘草 which has worked for the repletion and the restore lung qi. So all this will work together as a core formula to treat, to prevent the COVID-19. So from the scientific perspectives, we have conducted a comprehensive literature review about a possible mechanism of Chinese medicine on the COVID-19 virus. And we found that there are mainly 5 categories of their function. One is the antiviral effect. The other is immune moderating function, and the cytokine storm prevention, antioxidative activities, and the ACE2 receptor binding effects. So this has been published in the American Journal of Chinese Medicine. And we also work on the recommended Chinese medicine formula, which is Qingfei Paidu Tang, and it has been conducted research all over the mainland China, and also they have already treated more than 5,000 patients. So this is from the clinical practice guidelines, and also the Huoxiang Zhengqi capsule, as I mentioned, is worked on the medical observational period that they will not confirmed as COVID-19 patients. But Qingfei Paidu Tang is can be prescribed to all the confirmed cases and the different stages. Of course, in the severe and the critical stages, they will add on Western medicine. So we have conducted a research on the potential targets for treating COVID-19, a review of Qingfei Paidu and its major herbs. So this formula composed of 21 herbs and 5 classic formula. Actually, it's not single formula. It have been combined with 5 classic formula. It's the Da Qinglong decoction, Wuling powder, Shen Gan Ma Huang decoction, Juzhi decoction, and the Xiao Chai Hu decoction. It has applied to 1,265 mild to moderate COVID-19 patients in 66 hospitals within 10 provinces in China. Among them, and 1,241 cases has been discharged. And of the 57 severe cases treated, none has been transited to critical care, and 42 patients has been discharged. So we will focus on that Qingfei Paidu Tang to know its benign mechanism. So in the last China clinical guidelines, it has recommended for the consideration for mild, intermediate, and the severe cases. So we have systematically searched based on both the Chinese medicine and English databases, and found they have 5 different effects on the COVID-19 virus. And this is the results. And we can see that different herbs have different targets. And 7 herbs will be on the antiviral effects, and the 3 herbs on the antioxidative activities, and 9 herbs on immune moderating effects, and the 7 herbs on the ACE2 receptor binding effect. But of course, they have overlap. Some herbs, they will have both or different effects. So we also conduct a network pharmacological analysis of the traditional Chinese medicine in treating of COVID-19. And also we have different network pharmacological approaches to investigate the potential mechanism of the herbs. For the rehabilitation program that it has been initiated in our School of Chinese Medicine, and also collaborated of Hong Kong University and the Chinese University. The patients of COVID-19 after discharge will still have problems on their lung dysfunction, nervous system, mental health problems, and cardiovascular functions. And so that we also noticed that the post-COVID-19 pulmonary fibrosis is also a big problem to the discharged patient. So based on that, we have searched the literature, and also we have also referred to the different kind of guidelines currently. And we found that 麻杏石甘汤 and the 补阳还五汤 is the most commonly used for the discharged patient, as well as for the different symptoms of discharged patient. And also we have investigate the neurological and the mental problems of the discharged patient, and found that some people, they have like mental health problems, not only the stress, anxiety, but also they have lost their memory, and also they cannot sleep at night, insomnia. So all these things is it can be solved about according to the Chinese medicine, as well as acupuncture. Acupuncture is especially effective for the insomnia. And all this is a data mining about different kind of Chinese medicine approaches, not only herbs, but also like Qigong, 八段锦. So all this is also a kind of exercise, breathing exercise. So based on that, we have designed a special Chinese medicine outpatient program for discharged COVID-19 patients to retrospectively explore the body constitutions before the patients who were diagnosed as COVID-19, and also identify the clinical symptoms and the syndrome diagnosis of COVID-19 discharged patients, to evaluate the therapeutic effect with Chinese herbal medicine based on individualized treatment. This is a multiple center study at 18 districts in Hong Kong. And the setting is tri-party Chinese medicine outpatient clinics, which is collaborated with hospital authority, NGO, and the university. So the role of university is to provide the research training and the support, including protocol design, data monitor, data analysis, and the manuscript drafting. So the investigator, including all the traditional Chinese medicine practitioners in the hospital authority clinics. We have included 150 patients who has been previously diagnosed and also be infected with COVID-19 and discharged from the local hospitals. Yeah, the main syndrome survey was based on the WHO's guidelines, and also we will also refer to the 7th version of Chinese medicine practice guidelines for COVID-19 patients, which was published in the National Health Commission of the People's Republic of China. And the symptom collection also based on the CDC symptom list. The treatment program actually is individual-based scheme. It's not only the fixed formula or not only the fixed acupuncture. We have different kind of experts and set on different stages and reference formulas and acupoints for the Chinese medicine practitioners. So the participants will receive 3 months individualized Chinese herbal medicine treatment. And after 3 months treatment, they are free to either continue another 3 months treatment or enter into the 3 months follow-up period. The individual-based treatment, as I mentioned before, we have mainly divide them into 2 categories. One is the lung and the spleen qi deficiency syndrome. The other is qi and yin deficiency syndrome. The clinical manifestations include the lung and the spleen qi deficiency is shortness of breath, fatigue, anoxia, nausea, fullness, weak stool, and uneasiness. The tongue is pale and greasy because we will see the tongue of the patient to diagnose their different pattern. And the recommendation herbs actually is 法半夏、陈皮、党参、黄芪、炒白术、茯苓、 藿香、沙参和真甘草。So the qi and yin deficiency syndrome is like their clinical manifestation is different from the previous type. As shortness of breath, they have dry mouth, thirsty, palpitation, sweating, a poor appetite, and low or no fever, dry cough, and a little sputum, and they have dry tongue, fine or weak pulses. So the recommendation herbs is 南北沙参、麦冬、西洋参、五味子、生石膏、淡竹叶、当叶、芦根、丹参、生甘草。So all the herbs will be cooked for them. They do not need to cook. They will be cooked, packaged for them 2 times a day. And they will continue to see the Chinese medicine practitioner once a week. The primary outcome is the change in participants' health as characterized by Chinese medicine diagnostic pattern and the clinical characteristics and their body constitution scores. Secondary outcomes include the forced expiratory volume in 1 second and the lung function related assessment. And also their quality of life questionnaires and their body constitution questionnaires. So this is interim, some preliminary data because although we have already recruited all the patients, but most of them are in the stage of like they have already obtained 3 months or 2 months of treatment, but follow-up period. So totally we have recruited, that is the 70 participants in interim analysis. That you can see from this chart that most of the patient is 51 to 70 years old. It's not very old, but they have been discharged, infected by the COVID-19. And a female, the 63% is female and 37% is male. So their body constitution is mainly qi deficiency. And also the deafness deficiency, deafness constitution. So which is quite similar with the clinical guidelines of mainland China. The Hong Kong situation is quite similar. And most of them have chronic illness history. Because I think the chronic illness history is like one of the risk factors of a COVID-19 patient. Most of them have hypertension, high cholesterol, and a history of cancer. And their commonly symptoms is more than 25% they have insomnia. They cannot sleep very well. And also shortness of breath and fatigue, and also the cough, and they're sweating a lot, and they feel very thirsty at night. So all this is their most commonly symptoms. So actually the rehabilitation program is still ongoing, and we also collaborate Professor Baker to conduct another rehabilitation, both with Chinese medicine and exercise. We would like to promote available clinical service for the discharged patient and also for the prevention. Because in Hong Kong, the patient was isolated, and currently we use the Zoom chatting to prescribe herbal medicine for the mild to moderate patients in the Asian exhibition with the hospital authority. And also we would like to carry out clinical studies by gathering data from different distributions of the clinics. Would like to report to the relevant health authorities for feedback and endorsement for future infection studies. Because in Chinese medicine serial, no matter what kind of virus you got, that at that time you cannot investigate what kind of virus, but the treatment or the diagnosis system is quite similar. So I think, yes, that is the impact of our research, and we would like to move on to the policymakers and strengthen the existing system stance. Okay, thank you very much.
Hi, everyone. I'm very honored to present a clinical study here on the conference. So my name is Gemma Gao Yang, working at the Department of Sports, Physical Education and Health, Hong Kong Baptist University. So today I would like to present a research protocol for rehabilitation of patients with COVID-19, which combines the two potentially effective means, that is tele-exercise and Chinese herbal medicine. As we know, the COVID-19 is an infectious disease caused by severe acute respiratory symptom coronavirus 2. The first cases reported in Wuhan, China in December 2019. Since the virus outbreak spread out worldwide, and the latest figures published by the WHO is globally accumulatively more than 160 million people infected, around 3.4 million people died from the COVID-19. So from the these two figures shows the global daily cases and deaths respectively. So we can look here. So the pandemic shows no sign of ending or easing. So the COVID-19 situation isn't equally distributed in the different WHO regions. So here we can see the Americas hits the #1 in terms of the confirmed cases, followed by Europe and the Southeast Asia. Look at this figure, we can see more recently the situation in the Southeast Asia countries are getting worse and worse, in particular in India. So according to the news yesterday, so every day there are around 300,000 people infect, and around 4,000 people dies from COVID-19. So how about the pandemic, the outbreak of COVID-19 in Hong Kong? So the first two cases were reported in later January last year. And so the black bar here shows the latest figures published, reported by the 17th of May. So we can see more than near 12,000 confirmed cases, and more than 200 people died. This line chart shows, exhibits the 4 waves in Hong Kong. COVID-19, the virus, not only we know hits the multiple organs and the systems of a human being. So many patients after discharge from hospital are still suffering from one or more symptoms. So here Here shows some previous studies in terms of the long-term health impact. So we can see near 90% of discharged patients were still living with at least one symptoms 2 months after discharge. The figure a little bit decreased. However, there's still three quarters of patients suffer from the symptoms 3 months later. The major ongoing symptoms include common symptoms such as fatigue, shortness of breath, headache, impaired functions such as lung function, fitness, metabolic function, and immune functions, as well as some mental problems which are secondary to the COVID-19, including loneliness, depression, and anxiety. So as a result, rehabilitation, there an urgent call for further healthcare after discharge, and rehabilitation may help the patients to recover quickly from the COVID-19. And I think Professor Baker and Dr. Zhong already speak out a lot about the benefits from regularly exercise and the Chinese medicine. So I just briefly mentioned about that. Strong evidence has shown regular exercise has direct effects on immune system at the cellular level. And for Chinese medicine, Chinese medicine can improve the lung function by modifying immune system and governing qi and respiration. So we aimed to develop a novel approach to rehabilitation, combining tele-exercise and Chinese herbal medicine to help the discharged patients in need recovery from the symptoms. Specifically, we aim to evaluate effects on alleviating continuous symptoms and improving functional capacity, to evaluate effects on improving mental problems and health-related quality of life. And last but not least, to reveal mechanisms involved in the above-mentioned beneficial effects. For example, whether and how the gut microbiota plays a role in the exercise and Chinese medicine induced benefits. We believe our program will benefit the many survivors from COVID-19 and further to relieve the heavy burden on the current healthcare system. It's the first try to build up a clinically validated rehabilitation program, combined exercise and Chinese medicine. And we believe the succeed will have a significant impact to the world in the battle with COVID-19 and implicates the further battles with other new emerging diseases. So here shows our research team. So it's a multidisciplinary research. So the team consists of outstanding scientists, healthcare professionals with disciplinary expertise worldwide. So here, for example, Professor Baker, the PI of the research, he overviews the whole study. Professor Bian, Zhao Xiang, and the leader of the Chinese medicine team, and also Dr. Zhong, Linda. Professor Jia Wei, he is in charge of the laboratory test, and he also developed a novel objective measurement of depression through the metabolomics approach. Yet Professor Guo, he already delivered a speech on this reference. He is responsible for the data management and the data store. And here, Professor Weger, he's from America, and his extraordinary research had made a great contribution in pulmonary function, that means lung function, the lung physiology, especially in the field of the gas exchange. Methodology. So the program, the study is a 12 weeks randomized clinical trial with 4 groups. The patient will randomly and equally assigned to the combination intervention group with exercise and Chinese herbal medicine. Exercise, tele-exercise only intervention group, Chinese medicine only intervention group, and a wait list control. So the 2 intervention components. And for the discharge, the selection criteria, the discharged adult patient without pregnancy, without contraindication for exercise, and who are smarter phone user will be eligible. Yes, one of the 2 intervention means is tele-exercise. Tele-exercise is a novel approach for exercise rehabilitation. So in which the supervised exercise sessions will be delivered live online, and the patients will perform a simple but personally tailored exercise at home. And so the tele-exercise consists of aerobic exercise, resistant exercise, and inspiratory muscle trainings. At a frequency will be delivered at a frequency of 3 sections per week, 40 to 60 minutes per section. Except for the main part of the tele-exercise, patients are also asked to perform additional inspiratory muscle training sections to reach a dose of twice per day or every day. And also evidence has suggested the solid exercise protocol combined with the psychological approach can produce the greater effects. So we will include 30 minutes consulting sections every week to motivate and empower the patients to form regular physical activities, to regular exercise habits, not only during the study period, but also beyond the study period. So here shows some detailed exercise plan in the 3 sections in week 1. So we can see we arranged the aerobic exercise before the resistant exercise to produce more benefits. And because the patients after discharge from the hospital are relatively physically inactive and weak. So the intensity of exercise at the beginning is relatively low, and then increase gradually to reach the upper moderate level or near the vigorous level. And so here's the exact exercise they will perform. Linda already introduced the Chinese herbal medicine. So in this study, we will use another Chinese herbs named modified Baidu Gujing granules in a dose of twice per day and 5 grams per time for every day in the 12 weeks. So the medicine will improve the qi and the yin of the patients, the common symptoms of the patients with COVID-19. As I mentioned before, there's a multidisciplinary research. So we wide range of outcomes are involved in this study. So including the lung functions, fitness indicators, mental health and quality of life collected by the standard questionnaire. And we also look at the immune system, immune function and the inflammation functions, which will be tested by collecting the blood and the urine samples. We also will, the fecal samples will also be collected for the gut microbiota tests, as I mentioned. We will adopt a novel objective measurement of depression introduced by the Professor Jia Wei. So this table lists the detailed measures, let's see, including the, for example, the cardio-respiratory fitness will be measured using the standard 6 minutes walk test. And the dyspnea will be measured using the Borg CR10 scales. And we also measure body compositions, lung functions, and the metabolic immune functions. And there are also other measurements subjectively measure the quality of life and other mental health problems. Timeline. So after recruitment, patients will receive the first wave of measurements and then followed by other 12 weeks rehabilitation intervention or the usual care in the control group. And then we will perform the post-intervention measurements after the second measurements, patients will be followed up for 12 weeks. And the study will be end at the third wave of measurements. However, the patients in the control group will receive the same Chinese herbal medicine intervention for 12 weeks, given the ethic consideration. We just finished the 12 weeks pilot. So these photos are taken during the pilot study. And We also hold a press conference, and there show some media reports about our program. The protocol has just accepted by peer-reviewed journal, and the preprint full paper now is accessible online through the PubMed. So before ending my presentation, I would like to share some preliminary results from the 12 weeks pilot. We decided to take a quick action. Take a quick action towards the COVID-19. So the pilot was conducted before we received the donation. So as a result, so the condition you may see at that time, so we had the limited sources. So for the pilot, because the main purpose of the pilot is to test and to modify the study procedures and the study tools. So we just involved 4 patients in the pilot study, and all received a combined intervention, including 1 week tele-exercise and followed by 11 weeks Chinese herbal medicine. All participants were female, aged from 40 to 71. In terms of the chronic conditions before diagnosed as COVID-19, 3 were living with the chronic conditions, and including hypertension, chronic respiratory disease, gastrointestinal disease, and musculoskeletal disease. As in terms of the COVID-19 related characteristics, and the shortest hospitalization was 4 days, whereas the longest as long as 38 days. A symptom list were developed according to WHO's recommended symptoms list, and so the 4 patients reported of the following symptoms. So we can see 3 of them developed pulmonary fibrosis, and 3 of them had fever. We can see, so for the patient one, so sounds the patient one only reported on the loss of smell, and were free of other symptoms. So here shows the pre-intervention, post-intervention, and changes, and the 95% confidence interval, and the p-value of a paired t-test in terms of the lung function measures. So you can see here the FeNO in the green box. Actually, so it's an indicator of asthma to show the airway inflammation. The higher score indicates a worse situation. So we can see a negative value means improvement in terms of the inflammation situation. And so here is the inverse relationship. So I highlight here. So for the all indicators of lung function listed here, except for DLCO, and the DLCO adjusted for HIP, where the mixed results were observed. Other indicators, we observed improvement in the patients consistently. So here I look at the raw data and found for the DLOC, 2 patients improved. Another 2 decreased slightly. 3 patients had no change at all before and after the infusion for the DLOC adjusted for HP, and 1 decreased slightly. Bear in mind, there are also other indicators of lung function. However, at this moment, we still performing the data analysis. So at this moment, I have not report to have no results to report yet. So how about the fitness? We measured the cardiorespiratory fitness using the 6 minutes walk test and the 100 strength test. That's the golden standard measurement for muscle strength. Mixed results were mixed results were found among the patients. So look at our combined intervention. There are only 1 week exercise. So another 11, they received the Chinese medicine intervention. So this results may suggest the Chinese medicine alone may not have a significant benefits, significant effects on fitness. So here shows the mental health outcomes. We measured the personal well-being index to show the quality of life, the anxiety and stress subscales from the DAS-21, and also the loneliness general health questionnaire. The 3 variables in green box were reversed course. Were reversed. That means the higher score means the worst situation. So we can see, except for loneliness, all studied mental health variables improved after intervention. So here we can see the loneliness, the patients felt more loneliness after intervention. So these results will suggest us to put effective means to reduce loneliness in the counseling sections. Yeah, so this if you scan the QR code, it will link you to the website of our program, and so it is still ongoing. So your support will be very appreciated. Thank you very much. And here's the QR code of my webpage. So please scan it and find me and contact me. I'm looking forward to future collaboration with you. Thank you.
As a form of introduction, let me say that we're delighted actually to have Professor Frédéric Douteil, who will be joining us from Clermont-Ferrand, I think, who've just been, I think, promoted into the first league in France. Anyway, that's an irrelevant thing, but it's just, you know, it's interesting fact. Although irrelevant, quite interesting. And I think actually it's such a great idea. We're so grateful, Fred. On est vraiment ravis que tu sois avec nous. En fait, tu n'es plus là, mais c'est pas grave. Great.
Si, I'm here. Thank you very much. Merci beaucoup.
Thank you, Frédéric. The floor is yours.
Okay. First of all, thank you very much to welcome me. Ni hao. Thus, I will briefly try to do an overview of some articles that we published most of them in collaboration with your institutions. Thus, I will start by a quick introduction on Covistress. Covistress, in fact, it is a generic name for all studies linked with COVID. In relation, there are more than 20 studies in relation with COVID that currently I managed. It can be simple studies, such as studies based on questionnaires. It can be questionnaires on paper. Thus, those studies are on site. Most often they are in Clermont-Ferrand or in France, or it can be also some online questionnaires through internet. National or international. This is a case of the main Covistress study. There are also some studies with biomarkers of stress, and there are also some point of view. In total, there are more than 30 articles indexed in PubMed, and I will show you some. Just a quick overview of Covistress. I mean the main Covistress, which is an online questionnaire, international. This is the website. You can see that you can have access to a main questionnaire that is here, and if you want to go further, there are also some complementary questionnaires on physical activity, nutrition, sleep, oral health, or on specific occupations, such as if you work in an intensive care unit, if you work as a general practitioner, if you work in dental surgery, if you are a student, etc. Covistress is available in 10 languages. Thus, it's quite well spread around the world. Here, I present some institutions that collaborate with the study. You can see that there is, of course, Hong Kong Baptist University. You are definitely a great partner of this study. Actually, thus we started the Covistress study in France. Then it spread in Europe because I may have more partnership in Europe. Africa, we are each dot represent a country where we have a partnership and where the study is spread. Canada, and 2 partners in the United States. We have also Central America and South America. This is for Asia, and let us say Oceania with Australia and Indonesia. If you want to have some details on the Covistress influence of the COVID-19 epidemic on stress, it was first posted on March. Thus, just to let you know, the first lockdown in France, it was the 19th of March. Thus, it was before the first lockdown, and we get the ethical approval mid-February, and I think we were the first international study to get an ethical approval, because in mid-February, we were just beginning to speak about COVID-19, at least in Europe. I know that it spread before. It started end of 2019 in China, in Wuhan. But in France, it was quite new. But yeah, we even mid-February, we predicted the first lockdown. What we did not predict, in fact, was consecutive lockdowns. But the questionnaire evolves. We are working actually on version 3, and this study will not stop with in 1 year or 2 years. In fact, if you look at the data from the first SARS-CoV pandemic in 2003, it was nearly 20 years ago, it was not a pandemic, it just stayed an epidemic, but 5 years after, the healthcare workers who work in intensive care units, who took in charge patients with the first COVID, with the SARS-CoV, not SARS-CoV-2, the first SARS-CoV, 5 years after, they still have symptoms of exhaustion, post-stress traumatic disorder, PTSD, post-traumatic stress disorders. Thus, yeah, definitely this study is will continue. At the moment, we have around 35,000 international answers. Thus, it grows. Some thus, first, where does it come from? Let us speak a little bit about bats and species richness. In fact, bats, they carry a lot of virus, plenty. And bats are, let us say, a good host of virus because there are plenty of bats. They are, in fact, the first mammals on Earth is bats. And as you can see is in this photo, they like to live in community. They have social behaviors. For example, here you see they can lick each other. They can clean themselves and each other. Thus, all that it's an incredible way to promote new virus because, as you can see also in that photo, there are an incredible high number of bats on caves, and per square meter you may have thousands and thousands of bats per square meter. Thus, promiscuity, if you have plenty of bats together, it's very easy to spread new virus, and you know that virus they like sometimes to mutate. Some mutations happen, and the other interesting things is that they mix between different species of bats. Here you can see, for example, there is a big bat, here a small bat. In fact, here there are 3 different kinds of species of bats. Thus, they mix together between different species. And of course, it's also a factor that increases the development of new virus. Moreover, they have the ability to fly. Thus, it means that if they fly, they can also spread more easily some new virus. And the interesting things is that in fact, here you can see the number of species by animals and the number of virus that they carry. What I said is that there are more than 50 different species of bats, and it's just proportional. If they carry more virus, it's also because there are more species of bats. That's what happened to decrease the spread of the COVID-19 lockdowns. And nature took back its rights. We saw all over the world some quite amazing photos, such as deers in cities. It happened also in France, near the Alps, near Pyrenees. You can see a dolphin it's in Venezia in Italy. It never happened because during the lockdown there was no boat. Thus the dolphins, they came in Venice. This photo on the right, even if it may be surprising, in Europe, and you can see that the wildlife invaded city. Thus, maybe something to think is to respect wildlife, because if we get too close to wildlife, of course it may promote the emergence of new virus. And to speak a little bit about bats and coronavirus, it's very frequent. In fact, we estimate that in the regions where there are bats, around 10% people get some virus from bats. It is actually something very common. The Covistress study, most often all the Covistress study, they are based on lockdown situations, because at the peak of the pandemic, there was 4 billion people that had a lockdown, stay home, stop the spread. It's quite amazing to have more than half of the global population into a lockdown. And we want to look at changes in stress, changes in quite everything, every behavior. And we want to look at international levels. We are working, for example, now on the difference in response between countries. There are some countries that helped a lot their workers. If there was a lockdown, for example, in Europe, most often the different governments, they gave money to people if they were not able to work, and it's not the case in all countries. Thus, there are also some different, let us say, management of the COVID-19 pandemic between countries, and it's particularly interesting to see, and to compare between countries. Even if we did not think of that maybe at first, the COVID-19 had also some positive impacts. For example, pollution. This is a photo of actually of China. You can see the NO2 density, and when you are in orange, red, it means a high density of some of pollution. And during the lockdown, for the first time for many years, it became blue. There was no more pollution, and in some part of the world, for example, there are some. In India, there are some people they saw for the first time the Everest from home and from more than 1,000 kilometers, and they never saw the Everest of their life. Thus, and this is not actually. I will show you later some other photo, some other satellite image. It was global. There was a global decrease in air pollution. And the consequence of that it is that even if we speak about million dead people due to COVID-19, we can also speak about the long-term consequence of COVID-19 for people who get infected, but it also had some positive things, because you know that air pollution is one of the biggest contributors to many kinds of disease. It can be respiratory disease, and actually, when you look at data, you saw that there are many respiratory health diseases that improved because of the reduction of air pollution. The same for cardiovascular mortality. In fact, cardiovascular mortality decreased during the last year, 2020. It can also be allergic disease. Allergic disease, clearly, it is due to air pollution. I think I've chosen the wrong photo, because this is a photo of nature, of let us say wildlife. In fact, allergic disease is mainly promoted by air pollution. If you decrease the concentration, the level of particulate matters in the air, you will decrease allergic disease. PTSD, post-traumatic stress disorder, it will be the second tsunami of SARS-CoV-2. As you know, I'm a physician. I have to manage, now I manage the COVID-19 vaccination for 2 million people. But in my hospital, there are, let us say, 20,000 healthcare workers. Honestly, they are not very well. And yeah, and for some people, especially the people who take in charge the most severe patients, healthcare workers that work in intensive care units, for example, yeah, they are not particularly well. And the problem is that it will be long-term consequence. Thus, the second wave of SARS-CoV-2, personally, I don't think it will be due directly to a new virus or a mutant. I think we will experience really long-term consequence, but in terms of mental health. And I speak here about healthcare workers, but there are plenty of people that were durably affected by the COVID-19. This is just a viewpoint. In fact, for example, some people they were particularly adapted, let us say, to the COVID-19 containment, to the lockdown. For example, submariners, people who live in submarine. You know that when it is your job, you go for 3 months, 4 months, maybe 6 months consecutively. You spend 6 consecutive months inside a submarine. Thus, it was quite interesting, because actually we are doing a study with Marion Trousselard. Marion Trousselard is she is a professor too, and she works for the army, for the French army, and she managed all submarine people who work in submarines. And in fact, those people, yeah, they did not mind too much the COVID-19, because when you're in a submarine, you cannot even see the light. You don't have access to internet. You do not have access to. You cannot go on your phone. You cannot. Thus, in fact, there are some situations that were harder than the lockdown. Just to an example of rare disease, hemorrhagic conjunctivitis with pseudomembranous. We also saw some very rare cases. For example, this is an hemorrhagic conjunctivitis with pseudomembranous. It was the first case described in the world. We just described that case, but just to say that COVID-19 might have plenty of consequences, and some are yet to be explored. In particular, the consequence for the eyes. Yeah, some surprising consequence. Because the COVID-19, what I want to say is that it affects all the aspects of a human being, and they also think differently. And you know that when you have fear, you buy guns. At least in the countries where guns are available. It's totally not the case in France, but for example, in the United States of America, you can see in blue the SARS-CoV-2 pandemic. It's a number of cases. Number of cases of SARS-CoV-2. And here in red, you have the number of guns sold. And we did that study in April last year, and yeah, you can continue actually those curves, and it's quite amazing. The number of guns sold in America is directly proportional to the number of SARS-CoV-2 cases in the United States. This is quite, it's quite dramatic because there are some statistics, and you know that each gun will kill a certain number of people. Thus, I think in the United States, the consequence, the long-term consequence, I don't speak of 1 year, 2 years, 3 years, but the very long-term consequence, I think it will be those guns. Because if you increase the number of guns inside the USA, definitely you will have more death by guns. That's, yeah, I think there are some opportunities to myopia. Yeah, COVID-19, sweat, tears, and myopia. Why myopia? Because you know that you need to look far away sometimes to give a rest to your eyes. And when you are at home, when you are in a lockdown situation, most often, even if you have a big apartment, a big room, if there are more than 5 meters, 5 by 5 or 6 by 6, 6 by 6, it's nearly 40 square meters, 40 square meters for a room, a single room. Yeah, it starts to be quite a big room. Actually, most people, they don't have that. It means that most often, when during the lockdown, all the people, they need to accommodate. The eyes need accommodation. Because of indoor activities, because of screen. Thus, in fact, there will be a pandemic of myopia, definitely. Maybe it's not so, it's not a so dangerous disease, but it's also a consequence of lockdown, myopia. Yeah, about some particularities of COVID-19. In fact, I think it's one of the first disaster because it is a disaster with benefits on air pollution. For example, here it's in France. It's the explosion of the AZF factory in Toulouse. It was, I think, the past decade. Yeah, when there is, it contaminated. It was a chemical factory that exploded with plenty of components inside the air. We can also speak this time about the cloud of the radioactive cloud of Chernobyl. You can see that that France did not get the cloud, as it is officially said, at least. But COVID-19, the particularity is that, as I said, it has benefits on air pollution. Let us speak. We did this one study on in emergency medicine. Here you can see the number of admissions. In blue, it is in 2019, that's before the COVID-19 pandemic, and in red, it is in 2020. Thus, you can see that the number of admissions, the number of patients that go to the emergency department, it's quite constant. In my hospital, it's around 160 people per day. Okay. I will conclude. During the lockdown, there was a massive decrease of number of admissions. As I'm late, I think I will. Yeah, I have plenty of things to speak. You just stop me because I think I have much to say. Here, very interestingly, overload. In blue, it is the number of beds available, and in black, it is the number of hospitalized patients. You can see that there are less beds available than patients needing a room. Sadly, it is a situation in France. It's completely stupid. I totally agree. But every day we struggle to get room to patients. And what happened during the COVID-19? Surprisingly, it was the opposite. At least during the first wave, it was not at all the case during the second wave and during the third wave. It was overcrowded this time. But during the first wave, in fact, there was the pandemic of COVID was only in the north of France. I live in the middle of France. Clearly, during the first lockdown in France, there was absolutely no case of COVID in my department. Those people were totally afraid. They did not go to the hospital. But the number of beds available thus was very high. But you can see in black, this is the number of patients needed to be hospitalized. It was still quite constant. And after the first wave, we struggle again with less beds available than patients. Another thing that we are doing, and you just stop me. You just stop me when you want. If I'm late. You know that stem cell transplantations. Here I put a photo of a baby, but most often it is adults. When you are undergoing an allograft or a graft of stem cells, you lived isolated for 5 or 6 weeks. You live in a kind of bubble. Thus, interestingly, it was quite a good time to have stem cell transplantation during the first lockdown, because yeah, if you have to be locked down, yeah, why not doing the stem cell transplantation at this time? And with the potential very deleterious consequence for healthcare workers. Again, I think I'm late. I will just go very quickly, or I can stop. You can see that I'm just at the middle of the thing. COVID-19, a prison breaker. The situation in jails, in prison, was quite dramatic. In France, even if it's not, very well known, there were some cases of massive spread of COVID-19 in prisons, because social distancing actually is quite difficult in prison, and you know that there was a shortage of masks. Okay, thus to conclude, I just go directly to the end. If you want some collaborative work on the Covistress study, let us speak just about the online questionnaires. We are more than 35,000 answers, and we welcome any opportunity to work, and of course people who will write the articles and we will use the data. They can be first, second, third author. It's totally fine, and it's totally okay for that. I'm just the coordinator, and my job will be to avoid any duplicate and to avoid that two different teams in the world, because actually there are more than 70 people, but 70, not 17, 70, 70 people. Yeah, it's to prevent that two teams would like to work exactly on the same article. Thus, you need to tell me what you would like to do. And of course, data are accessible. You just need to tell me which data you would like, and we will have it. And in fact, to conclude the last sentence, the Covistress study, we are looking at absolutely everything, everything that we can. We want to embrace all aspects of health, of behaviors, of consequence of COVID, and the particularity that I'm an occupational physician. Thus, we go very deep in details for occupations. Thus, it's quite a particularity because, as you know, there are few international articles depending on the occupations. Thank you very much. Thank you very much. If you have some questions.
Thank you, Fred. We have, we're running a little bit late, but we've had 4 speakers there. And really, if anybody has any pressing points or questions, Professor Cabestan, Jean-Pierre.
I don't know how much time do we have, but well, thanks a lot for all the presentations. It's been very useful and very informative. I have a question. Maybe you're going to be shocked, but it may open your appetite. No one has talked about sex.
Yeah, we have a sex.
Finish my question. First of all,
yeah.
the impact of COVID-19 on sex life, and whether, I mean, it relates to a number of issues raised by all the speakers, whether a healthy sex life may have an impact on stress, on a lack of stress, on getting out of COVID, in circumstances which may be very different because of the level of lockdown, you know, varying from one country to another. But I would like to invite the speakers to maybe say a few words in the time which is allowed to us on this issue. Thank you.
Yeah, sure. In fact, it's just that it took us 1 year to get the ethical approval for the Covistress study. Why 1 year? Because each time that you speak about something that people do not consider, let us say, usual, even yes, sex life is common and it's part of life. It's always difficult. For example, I did a study 5 years ago on ASD, autism spectrum disorder people, and more. First, they had ASD. Second, they were children. Thus, if you do a study on children and on a vulnerable population, it's very difficult. I get 2 years in France to get the ethical approval. Thus, to answer you, yes, we have a Covistress study, and the Covistress study will be available, I hope, in 1 or 2 weeks. It will be very soon.
Does anybody else want to talk about sex?
Just a quick one. The physical benefits of sex, of course, are well documented. And so there are benefits, I suppose, to immune function and health. But the problem is, of course, with the social distancing, it's very difficult to engage in the process, really. But I think there are benefits to be accrued from a sexual endeavor, shall we say, in terms of immune function and health.
Very good, Julien.
Yes.
We will cover all those aspects in the Covistress. I think if maybe I don't know in Hong Kong about the ethical approval for the Covistress study. I don't know if it will be easy or not. But if I think international comparisons for sex behaviors during the past year, I think it would be very interesting international comparisons because in fact we have quite different habits regarding sex behaviors.
Can I, as chair, could I say if there's one more pressing question? If not, I'll have a little sum up myself. But is there one more pressing point? I'm being told we have to go because because of this part, the speakers are invited to Bistro Bar. Let me just say, I thought it was a great session. I learned a lot. This is, impact action research in a sense. It's interesting. I mean, to listen to you guys in relation to the protocols and everything that you're developing and thinking this is very focused towards it's focused towards testing, it's focused towards action, it's focused towards impact. And I think that was a very interesting dimension in a way, because of course what we do as well is also focused towards impact. I mean, but it's perhaps in a slightly rather different way. And so, and I think that's something that struck me from the three presentations, three physical presentations, and then Frédéric's presentation from afar. I mean, I think this has been it's been a fascinating early session. Time is, however, pressing on. So if there's a final final comment, if not, I'll thank all of our paper givers, and we will reconvene for a different sort of, maybe it's a type of discussion after lunch, but we'll carry on with our transnational and transdisciplinary conversation. Thank you.